We'll go ahead and get started. As I said, my name is Leanne Foster, and I am a member of the Provider Outreach and Education team here at WPS. And I'd like to once again welcome you to our webinar regarding skilled nursing facility revalidations. We are going to focus on those revalidations and the changes to the CMS 855A, but I do have just a couple of housekeeping items that I do want to go through with you before we get into our agenda for the day. Training material is available for today's session, and the material that is available is the PowerPoint that I will be sharing with you today. If you would like to download that, you certainly can do that from our Training Center page, and a link to that is going to be placed in the chat. It's not a requirement that you have that presentation to follow with us today, but it is an option that you have if you would like that. Once you get to that Training Center page, you're looking for today's event. It should be one of the top couple of events, and you'll see a link for training materials. Click on that link and it'll allow you to download that. You'll also see our upcoming events, and you'll also notice that we do have encore presentations available out there. As I mentioned, I am recording this session, so it will be available for 60 to 90 days on our Training Center page for you to view. It is also going to be on our YouTube page after those 90 days. However, we recognize you may not be able to access YouTube while you're at work, so it will be available on our page for those 60 to 90 days without needing to access YouTube, and that'll just allow you to see anything you need to see again, or if you know someone who would benefit from this education, you'll be able to share that with them. Questions are going to be handled through the chat feature, and Aline will be monitoring those. I do encourage questions. Please throw those in there as you have them. I certainly do not want anyone to forget their questions. If for some reason there are more questions than there is time allotted, don't worry. I will put together a follow-up document, and I will send out those questions and answers to all confirmed attendees of this session today, so you will have all of that for you. And also at the end of this session, you will have the opportunity to provide us some feedback on this session and our and topics you'd like to see for upcoming educational events. We do look at those. We certainly do appreciate your time taking those. Your feedback is critical to what we do, and it helps us improve our education and make sure that it's relevant and meeting your needs. But also, this is an opportunity for you to tell us what educational topics you would like to see in the future so that we can continue to provide the education that is most valuable to you. And my last piece of housekeeping here is our disclaimer. So the material presented today is meant to be an educational tool, and it is accurate as of today. If you've worked with Medicare for any period of time, you are aware that it does change often. So I will encourage you to continue to monitor official CMS communications, which include our website, for any updates to rules or regulations. I'll also be answering questions based on the CMS regulations today. So on our agenda for today, so our focus today is going to be the off-cycle revalidations for skilled nursing facilities using the 924 version of the CMS 855A. In the fall, CMS did update the CMS 855A to include some cosmetic and technical changes to existing sections. However, there's one significant change, and that was the creation of Attachment 1, which is the skilled nursing facility disclosure. The purpose of this attachment is to collect information that SNFs are providing to us today regarding their ownership, but it also has expanded information regarding ownership and managerial control, which also includes disclosing additional disclosable parties, or ADPs, that are related to the SNF. So during this session, we are going to cover an overview of the SNF revalidation effort, why we're doing it, including the timeline and how to submit. We're going to talk about when you should be submitting that SNF revalidation, and then we are going to be spending a lot of time on that Attachment 1 skilled nursing facility disclosure. That's really the biggest change this round of revalidations to how SNFs are reporting their ownership information. So we'll talk through what an ADP is, who needs to be reported, so that you can successfully revalidate that skilled nursing facility. We'll also include some tips, some things that we're seeing as applications are coming in that are going to help ensure that you have a smooth revalidation process. I will be using some acronyms today. I'm not going to read these off for you. However, you have them in case you need them, because, again, I will be using those and I want to make sure that you're aware of what those are. So I'm going to start with an overview of what is happening with the SNF revalidation. So ownership reporting is a critical part of fraud prevention. It is an essential tool that is used by CMS. The best way to prevent fraud is to keep those that would do harm to the Medicare Trust Fund out of the program in the first place. So as with other suppliers, SNFs have long been required to report their ownership and managerial control information in Section 5 and 6 of the CMS 855A. It's pretty standard. If you filled out an 855B, it's there as well. However, with the new version of the CMS 855A, which is the 924 version, SNFs are now going to be reporting expanded ownership information, as I mentioned, and that expanded information is contained in the attachment 1, which we'll be going through today. In addition to the ownership and managing control information that SNFs have always provided, who are your owners, who are your managers, we'll ask for base information about those entities and individuals. CMS is now requiring additional information about other parties that the SNF is associated with, and this includes ownership structure of those other parties. So they're really parties, they're just expanding what they need to know. So this expanded ownership reporting has actually been a part of the CMS proposed rule as far back as the start of the Affordable Care Act. And it has been included in the Social Security Act for some time. However, CMS hasn't implemented this into the enrollment process until now. And they started in October with the new variation of the form, or version of the form. The reason they held off was because they were working with the provider community through public comments to ensure that this new rule was going to meet the needs of what they were trying to accomplish. And they took that feedback and have now taken that, and the rule was part of, and those comments were part of the update to the CMS 855A, and that was implemented, as I stated, back in October. Because of the significant changes, CMS has directed MACs to conduct off-cycle revalidations to collect information that's requested on that attachment 1 SNF disclosure document, because that is not information that was reported previously. So because this is going to be an off-cycle revalidation, we'll talk about the timeline, but it's not going to impact the normal 5-year revalidation cycle. And we'll talk about that a little bit more. But to submit these, you are absolutely going to need to use either the updated CMS 855A, the 924 version, or you're going to have to submit it through our provider enrollment chain and ownership system, also known as PECOS. Now, a couple of links that I've included for you here on this slide. The first one is going to be a link to the Social Security Act that governs the request for expanded ownership and managerial control. And it's also including a link to the Medicare revalidation list and the application. As I mentioned, this isn't changing your revalidation cycle, but I've included this list so that you can see that and have it if you need it. So we've gotten multiple questions throughout this process of regarding the timeline. It's changed a couple of times since we started educating on this and requesting those revalidations. So first and foremost, the off-cycle revalidation started in October. Letters were sent in a staggered way, October, November, and December, saw letters being sent out to skilled nursing facilities requesting them to complete the off-cycle revalidation. As I said, it's going to require the new version of the form or to be submitted through PECOS, and we'll talk about how to access the attachment in PECOS later on in the presentation. It did impact all skilled nursing facilities, any them to revalidate. Now, those letters that went out all had different due dates on them, depending on when they were sent. If it was sent in October, it was a different date than if your letter was sent to you in December. Those dates didn't change on the letter. However, in December, what CMS did is they did change the due date. Even if you have a revalidation letter that indicates your due date is February, your due date is May 1st of 2025. So they've kind of extended the time that providers had in which to collect that information, recognizing that there's quite a bit of information there. However, it doesn't mean that we want you to wait until May to submit that revalidation, and we'll talk about that a little bit more as well. It's super critical that you are submitting these revalidation requests. If we do not have that revalidation request to us or completed by to us by that May 1st deadline, it could result in payment interruptions where we're not processing claims because we're waiting for that revalidation information. That could escalate to a deactivation for failure to respond, and you want to avoid that. So again, it's critical to get that application into us by May 1st. Even if it's in here, if it's in process, it could be in development, we're still processing. Our process may not be completed on May 1st, but we need to have a response by May 1st in order to avoid any of that payment interruption. Sorry, that froze up just a little bit. So this is what that revalidation solicitation is going to look like. It was sent out as a physical letter. This was not sent out as emails. Revalidations are going to be sent out to a correspondence address, practice location, and if it's different, it'll also go out to that special payments address. So there's the potential for you to have received 3 letters at 3 different addresses. They typically go out, they're very colorful. Typically they go out, it's going to be some combination of a yellow letter and a green envelope, just so that it isn't missed. They do that intentionally to make it stand out. Now that letter, you could have received multiple. If you are working with a SNF that has multiple enrollment records, they would send out a letter per enrollment record because we're enrolling the enrollment record and all of the information contained on it, not the tax. So if you have a skilled nursing facility that has 5 enrollments, they probably received 5 letters or 5 sets of letters. What will be contained in that letter is going to be the provider's name, the address, and it's not going to be necessarily all of the addresses. It's going to be the address it's going to. You are going to see the NPI, or that National Provider Identifier for the SNF, and you're going to see that Provider Transaction Access Number, that PTAN for that SNF. As I mentioned, CMS is going to have a determined due date. When they began having the conversation about changing the due date to May 1st, they did advise Max, we did ask, they did advise us to leave the CMS determined due date in the letters versus changing it to 5/1. However, you do have until 5/1. You'll hear me say this a couple of times, though. I'm going to encourage you not to wait until May 1st. If all of the revalidations come in at about the same time, there will potentially be some processing delays because there's quite a few letters that went out, obviously. So we do encourage you to send it as soon as the information is ready, but again, recognizing there's a lot of information to get put onto that application is the reason for that extension. Your submission options are PECOS and the revised CMS 855A. Either is acceptable. If you have already set up in PECOS and you've submitted changes or even your initial enrollment for your SNF through PECOS, my recommendation is going to be that you do your revalidation through PECOS. This is really going to save you time because you're going to go in and you're going to be able to see all of the information that we currently have on that enrollment. You'll need to go through and review, make any changes, any additions, any deletions. In the ownership section and the managing control sections, you'll be able to see the questions that are contained in the attachment, and we'll show you that. We'll talk through that later on in the presentation. But then you're going to be able to submit that electronically. Processing time is also faster with that because we're able to leverage some automations for data entry and for verifications through PECOS. So if you have not set up through PECOS, you can still submit your revalidation through PECOS. It will allow you to do that. You'll just have to manually enter more information. It may also appear as though it's an initial enrollment, and that's simply because you're having to manually enter information. It will come through to the MAC as a revalidation, and it will get connected to that revalidation letter. If you choose to do it on the paper application, that is perfectly acceptable. That is a PDF document. That is a form, so you can fill it out using, obviously, on your computer, but it's going to have to be downloaded and it is going to have to be mailed to us. That paper application cannot be faxed or emailed to us. The only electronic method to get that to us is utilizing PECOS. So those are your options. So next we're going to move on to the details of the disclosure itself. This is really where the big changes are. And we're going to look at both the organization and individual portion. There are going to be similarities to what you're currently seeing requested in section 5 and 6, and we're also going to highlight those differences. One thing I do want to state as we go through this, SNFs are now to report all ownership and all managing control information in the attachment 1 SNF disclosure. SNFs will no longer, whether it's a revalidation, whether it's an initial enrollment, whether you're making changes to that ownership, SNFs will no longer utilize section 5 and 6 for their ownership or managing control information. In fact, MACs have been directed that if the information is in 5.6, but not in the attachment, we cannot take that information from section 5.6. We do have to develop for it to be in that attachment. So the sections will have similar questions, they'll have similar information, but they're not interchangeable. And that's super important because that is one of the things that we're seeing with development, is we're seeing information in 5.6 that's not in the attachment. So the things that need to be reported in the SNF's disclosure, some of them are going to be very similar. They're going to include the same regulatory information that was always requested. So what you'll see is we'll still be asking for the name of the entity or the name of the individual. We'll still be looking for tax ID and social security number, date of birth, address information for the entities. We're still looking for that same information. But what has happened is it's been expanded on who needs to be reported. The categories are still going to be individuals and organizations, as I stated, but we are going to be asking for all governing body members. That's very similar to what we've asked for in the past, but it is going to be expanded based on how questions are answered in the attachment. We are going to be asking for all officers, directors, partners, trustees, and managing employees. So this has changed a little bit. It's going to be all trustees, regardless of the type of trust that's set up. You're also going to see some differences with LLC owners. So previously, there was a limit to who corporations would need to report. They need to report their officers and directors, and there was a 5% threshold for those LLC owners. That 5% threshold has been removed, so it is all owners, all directors. That percentage is no longer a part of this disclosure. It doesn't change anything in 5 or 6 for your other facilities. This is specific to SNFs. As I stated with the trust, All trustees have to be reported. One thing I want to go back and say there is that it's individuals or organizations that are trustees. And the biggest change is going to be the addition of reporting additional disclosable parties or SNFs for, or excuse me, ADPs for SNFs, and that includes, again, organizational structure of those ADPs. So what they're doing is they're going deeper into the levels of that ownership. And an ADP can be an individual and it can be an organization, and we'll talk about that as we go through. So let's first define an ADP. So ADPs are defined in the CFR in section 424.502, and I've included that. That's one of the questions that we get quite a bit is who is an ADP? And that makes total sense. The one thing I can tell you, though, it's not defined by a title. It's not necessarily even defined fully by a structure. It's going to come down to what kind of control is that individual or organization exercising. So an ADP can be an entity or an individual who is providing that operational, financial, or managerial control. This can include financial or cash management services. They're providing those services to the SNF. Perhaps they're providing management services, business management services to the SNF. It could be administrative services, clinical consulting services. It could be accounting or other financial services to the SNF outside of that cash management realm. So what it really comes down to when you have an entity that you're wondering whether or not you need to report, you need to ask what services are they providing to that SNF. However, there are also questions in the application that are going to help you identify those ADPs, and we'll talk about that. Something else that is considered an ADP, an ADP can be an entity or an individual that leases or subleases property to the SNF. Okay, and it also could be somebody that an owner of at least 5% of the total value of the SNF's real property. So we're getting into that, again, that property piece of it. So some examples would include, as I stated, they're providing that operational financial control, that management, that administrative. I've listed them out here so that you have that for reference. Which brings us to the sections themselves. As I mentioned, this disclosure has two main sections, organizations and individuals. One question that we do get is, if I'm reporting an organization under the organization section, do I need to report owners or directors of that organization as individuals? And the answer to that is yes. So you have to fully disclose the organizations and their ownership as well. So again, it's those levels. So each section is going to be broken down into subsections, and we're going to cover the structure. I'm going to take you through the new subsection D, and it's new subsection B for the individuals. This is where the new information is, and it's intended to help you better understand how to complete it. So I'll start with organizations. With organizations, the structure is going to be section A, which is the identifying information. This is going to be the information that you've always provided, the name, the tax ID, the organizational type. That's section B. That's going to be that organizational structure. This is something that is currently being reported. One thing that is going to be a little bit different because of its location is information regarding a chain home office. So if there's a chain home office involved with this particular SNF, previously that information was reported in section 7, just identifying that chain home office. That has been moved to the additional disclosable parties section in that attachment, so that when you got there, you didn't have to go back or you weren't separating it. The questions were very similar, so CMS consolidated that to make a better user experience. Now, section D is where things are new. These are questions that you've not been asked before. This is asking for the entity reported in section A. What is their relationship to the SNF, or if they're an ADP of the SNF? And we will talk about that. And then section E of the organization disclosure is going to be that adverse legal action information, which is, have they ever had any adverse legal actions where you would report any actions taken in resolution? That is something that's currently being reported. So let's take a little bit closer look. I know that the image here is just a little bit small, but this is a screenshot of the paper CMS 855A. These questions do line up in PECOS. Visually, they'll look just a little bit different, but the questions do line up. So questions 1 through 5 are going to be asking the question about direct ownership. So if you look at the image that you see on the slide, the first question is if the SNF is a corporation. The second question is if the SNF is an LLC. And the reason I point that out is you're going to answer, you may not answer all of these questions. So if the SNF is a corporation, you need to answer, does the reported organization, what's listed in section A, have 5% or greater ownership interest in the SNF? Yes or no? And if you answer yes, you will be asked to provide an effective date or an exact percentage. Now, if your SNF, say, were not a corporation, but they were an LLC, you do the same thing. You'd answer yes, but to question 2. You'd answer no to question 1. So these questions are all structured based on the corporate structure, the structure of the SNF itself. So make sure you're reading those questions carefully. And you may find, like I said, some may not apply and some we just need a little additional information. And again, 1 through 5 is for direct ownership. 6 through 7 is going to be indirect ownership, but it's going to be, say there's a parent company. So it's going to be asking those questions. When you get into 6, it'll say if the SNF is a business structure other than LLC, general partnership, or limited partnership. So you're kind of choosing the one that best applies to your SNF structure. Okay. Question 8 is going to be asking about mortgage and security interests. Similar to questions 1 through 7, it's just shifting to its focus as far as what type of interest. Question 9 is related to trustees. Section 10 is about that managing control for that entity. You may answer more than one question yes here, so you do need to look at how those questions are phrased and how they apply to your organization. Question 11, you can't see it here, it's in the back, but question 11 is asking about the services purchased. And let me take you out there. And you can see here, I'm going to scroll in here a little bit. Question 11 is going to help you identify the ADPs because it's going to ask about the services that the entity reported in A furnishes. And this section is going to be completed once for each organization. So you're not going to be able to list all of your organizations in one section A. You'll complete section A and you'll answer the questions for that organization. If they have multiple organizations, you'll do an additional section A and complete the questionnaire for that particular organization. The questions 12 and 13 are about the lease, sublease, and ownership of real property. And something that is kind of key here that's going to help you identify those ADPs, if they're answering yes to any of the questions 9 through 13, that helps you identify what is an additional disclosable party. So if you're not completing it, if you're just trying to determine if someone's an ADP, go through questions 9 through 13 for them. And if you're answering yes, they need to be reported on that application. Questions 14 through 18 things change a little bit. And I'm going to go back to the application just so that you have a little better visual on that top portion. But here you want to look at these instructions. This is asking whether the reported organization has an ownership or trustee interest in any additional disclosable parties of the SNF. So it's no longer the relationship to the SNF, it's relationship to other additional disclosable parties that might be reported. So it just changes it a little bit. The questions are similar, but it's asking about if the ADP is a corporation, if the ADP is an LLC. Okay. So you are reporting that. We're looking at corporations, LLCs, partnership, limited partnerships, trustees, just like we were with all the previous questions. Moving on to question 19. So question 19 is a question that is, and it does state that on the form, it is a question that is only answered if the entity reported in section A, so again, doing this individually for each entity reported in section A, but if they report yes to 14 or 18, we do have additional questions for them. And it is about that interest in the SNF or the ADP, and they define that interest as ownership, trustee, or LLC managerial. If you are answering yes, if you are answering yes to this question, you do have to list that legal business name. And they're using this to cross-check the relationship, and they're also going to be looking for the organizational structure diagrams, and we'll talk about that a little bit later, but they're using this information to cross-check all of that and also do their verifications on whether or not this is acceptable for the revalidation process. So next we're going to look at the individuals. Their subsections, again, there's going to be some similarities. It's going to feel like we're asking the same questions, and we are, but from a different perspective. So as with the entities, it's going to be asking you a series of yes or no questions about the individual that's reported in section A of the individual category in the disclosure statement. You will need to list all individuals individually. So if you've got 10 individuals, we're going to expect to see 10 section A and all of the questions that correspond to that for that individual. So section A here is going to be the provider's name, it's going to be date of birth, it's going to be their identifiers. Section B is going to be that new piece. This is going to be the part where we're asking about the relationship to the SNF, and if they are an ADP, we're asking about the ADP's relationship to the SNF or their relationship to that ADP. And then section C is going to be that adverse legal action information for that individual. So looking at questions 1 through 5, 1 through 5, again, you're going to see is going to be that direct ownership. I'm going to go ahead and go there for you. So again, you're going to see that it's asking if the SNF is a corporation, if the SNF is an LLC. So for this individual that you put in the individual section A, you want to ask the questions about the SNF that's actually being enrolled on the or revalidated on the application. What is that SNF structure? And answer the yes or no questions accordingly. 6 through 7 are about indirect ownership. So if these are individuals that have ownership in an organization that was listed in the organizational category, that's what we're looking for here. It's going to be completed, as I said, based off of the SNF structure, and you're going to answer all of the questions yes or no. And if yes, we're just going to need some additional information. And that can change a little bit. If you get into the part where there's managing control, we may ask if they're an officer or a director. If we're talking about that mortgage security, we'll ask about mortgage or security, what type of ownership that they have there. When you get into subsection questions 8 and 9, we're going to be asking about the relationship to the SNF. So question 8 is for corporations, and we're looking for those officers and directors that are going to be reported separately in Section A. So we're asking that question for them. Question 9 is for non-corporation governing bodies. So all governing bodies need to be reported. So the only exception here is going to be government or tribal organizations that are going to be legally and financially responsible for the revalidating provider. In that case, they're going to provide a statement that will affect the application. It's a statement of financial and legal responsibility. So they would report that organization, and then anybody that has that might be acting as an authorized official that has that kind of managing control. But say, for instance, if you have a county, we don't necessarily expect the entire county board to be reported. If the county, whomever is on that board, is financially and legally responsible for the entity, that's where that statement comes in, just as it does today for reporting that type of oversight in sections 5 and 6. So question 17, again, similar to the organizations, but we're based on the ADP organizational type. And I'm going to go back to that application for you. Pardon the scrolling. And again, there's instructions here. So this is going to be asking whether the individual reported has ownership as an individual trustee, governing and managing interest in any ADP of the SNF. So you have to look at what additional disclosable parties are being reported, and this is asking if you have individuals that have direct, indirect ownership, managing control of those ADPs. So it's asking the questions very similarly, in a very similar fashion as it did to the organizational subsection, but it's asking about the relationship to that ADP. Questions 17 through 22, or pardon me, 22 and 23 are only addressed if questions 17 through 22 had a response of yes, any of those questions. So again, this is identifying those ADPs so that you can know whether or not the individuals that have oversight of those ADPs need to be reported. So next I want to talk about accessing this information in PECOS. In the application, it's clearly that additional attachment that's been added. In PECOS, it's a little bit different. The questions are the same, but they, instead of creating a new section, they expanded upon the existing organizational control sections inside of the PECOS system. So these additional questions are only going to appear for providers that have their provider type set as skilled nursing facility. So if it's set up as a hospital, if it's set up as a medical clinic, you're not going to see these questions. So in the topics list of PECOS, about middle of the list, generally, you're going to see organizational control and individual control. That is essentially representing section 5 and 6 for all other providers. For SNFs, it represents that additional disclosable party section. And the questions expand, as I said, when that provider type is a SNF. So when you go into those, you will have to answer questions as you go, but questions will be added as you go, as you add the yes or no questions, effective dates, legal business name if needed. Those sections will expand if you select yes. If you select no, you will not be asked to enter any additional questions. So as I said, CMS decided that rather than creating a separate attachment, they would expand because it's asking for very similar information, existing sections for organizational and individual ownership and managing control. So some reminders before we get into Our last topics before I check in with Aline for questions. Attachment 1, again, is replacing section 5 and 6. That's one of the things that we're seeing, is that we're getting section 5 and 6 for SNFs. If you're doing that in addition to the attachment, please, please don't. That's actually additional work you do not need to do. However, if you're doing 5 and 6 and not the attachment, we need to get that transferred over because we can't accept it in 5-6. Make sure that you're including all of the owners. This includes direct and indirect. That indirect, as I mentioned before, happens with parent companies where you have the owners of those parent companies. They need to be reported. Those owners of those LLCs, those directors of those LLCs, they need to be reported as indirect. Managing control, direct or indirect, and all additional disclosable parties. And again, I mentioned how there are those questions that will help you identify those ADPs. It's important that you look at that because ADP is not fully just identified by a title or a job function. It has to do with what those services are that are being provided for those providers. Make sure you're including the organizational charts. We're going to need them for all of the organizations that are being provided on that application, so you may be needing to report more than one. And as I said before, submit them sooner rather than later. You do have until May 1st, but certainly don't feel as though you have to wait until May 1st. If you get it in and we develop, even if that development time goes past that May 1st, you're allowed 30 days for that development. We will continue to work with you to get that. We will develop and that time will be yours to respond to get that information. We are wanting to avoid having to either put some type of interruption of payment or deactivation in place. And as I mentioned, this is what we're trying to avoid is failure to respond. Now, this has changed just a little bit. The initial solicitation letter, everyone was given 90 days. CMS did expand that until May 1st, so it may be longer than the 90 days for you because of that extension of that time frame. We will do what we can to follow up. As I mentioned, development requests will still have the 30 days. And incomplete responses to a development request will be a non-response to a revalidation. So what I'm saying to you there is to make sure that you are responding to development requests timely so that we avoid any payment interruption for you. And those payment interruptions can be a stay of enrollment. So what happens if that happens, if we don't get a response by that May 1st date, the provider remains enrolled. It is an interim status and the provider is not deactivated, but we are rejecting claims because we are trying to get that revalidation in. Now, the revalidation isn't necessarily something that has to be reviewed by that May 1st date, but we have to have it. Receipt of that revalidation indicates a response. We'd like them to be all clean, what we call clean, not need any development and ready to just go through the system. That's the simplest path. However, we do understand that we're asking for a lot of information here. So get that revalidation to us so that we can mark you as having responded. If it goes past that stay of enrollment, then the provider could have their enrollment record deactivated and their billing privileges would be deactivated with that. That does actually terminate the provider's PTAN, and then they would have to re-enroll. And again, we're trying to avoid that. Both absolutely have great impact to the provider and their billing cycle. So again, it's imperative and critical for you to get that revalidation application in-house as soon as possible. I have a couple of resources I'm going to go through before I check in with Aline for questions. First is some CMS resources. So I'm going to take you out to a couple of these. I've included the CFRs and a link to the application and CMS's provider enrollment site. The top two resources, though, we didn't go into those, and I want to show you those. The first one is guidance for SNF attachment on Form CMS 855A, and the second is the SNF attachment 1 workflow in PECOS. So the first one and actually I want to show you how to get to both of them. The first one, that guidance, is going to talk through a lot of the information we covered today, but it's going to give you some additional information on reporting those ADPs. The second resource I'm going to show you is actually going to walk you through how to add this information into PECOS. So to find both of these, from the CMS website, you'll want to go under Medicare and Enrollment and Renewal, Providers and Suppliers. And you want to go to, not revalidations here, you want to go to Medicare Enrollment for Providers and Suppliers. You want to go here and scroll down to this green section. It's here to make it a little bit more visible. So if you scroll down, you're going to see the skilled nursing facility off-cycle revalidation, and there's going to be two PDFs here. This first PDF is going to be the guidance, and I have that open here. This lays out, again, the information that we talked about in great detail, talks about the statutory data. It does also have the adjusted due date if you need it. It gives a few more examples, just a few more than we were able to talk about here today, but it does have that information for you. So it also, at the end, pardon me with my fast scrolling, does have a list of frequently asked questions that you may find helpful. The other document that's out here is going to be how to report it in PECOS, and that's because it's not stated as its own attachment. CMS thought it would be helpful to have the workflow out here, especially as we started this. So what this does is it gives you a step-by-step with screenshots walking you through how to complete that attachment. All of the questions, again, are going to line up with that paper 855A, but this is to help you know where you need to go for that. We do have some resources on our website as well. We do have a chart that walks through how to complete that section and what needs to be reported. We've also included a link to the 855A, and then we also have a page specific to the skilled nursing facility off-cycle revalidations that are available to you. So with that, I am going to check in with Aline to see if there are any questions.
Leanne, that was great information, and yes, we have gotten a few questions. The first one, and I'm just going to ask them in the order in which they were put in the chat. So first one from Angie says, if we mail, does it have to be postmarked by May 1st or received by May 1st?
We're going to look at that postmark. That's going to be the receipt date. I wouldn't wait until May 1st to send that in, though, because the CMS may give direction for stays of enrollment to go in on May 1st. So I would encourage you to send it in before that May 1st. We're still waiting for further direction on that. Good, great question.
Okay, great. Next question is, if multiple SNFs are enrolled with the same tax ID, will failure of one SNF to revalidate affect other provider numbers under that same tax ID?
It's going to be by enrollment. So if you have multiple enrollments for a SNF under the same tax ID, I'm just going to throw out 5 as an example. If you responded to 4 of them and we have that application and we are actively working through that application, but 1 we did not get a response, it's going to impact the 1 we did not get the response. It's not the way SNFs are enrolled, they have separate enrollment IDs, so it's going to be based on enrollment ID. However, if you reverse that and you submit an application for 1 of them and not the other 4, the other 4 would be impacted because we wouldn't see the revalidation for them.
All right. Thank you. Next question. This is from Melissa, and I did make a note that this is when you were on slide 24, when you were talking about subsection B, questions 7 through 22. And she says, government agency here, what kind of statement is needed for our board?
Give me 1 second. I'm going to give you a little bit, I'll call it a cheat, but it's going to be something that's going to help you Pardon me, all. I can't. It's not coming up. Okay. 1 second. It's going to be back in 5.6. So you're not completing your information section in 5.6, but there's verbiage here that'll be helpful. And I'm looking for right here. So right here, government and tribal organizations. I believe it's in the attachment too. I'm just coming here just for speed. So the provider must submit a letter that is stating that the government's going to be legally and financially responsible. So basically, you need this. You need your entity to attest to that statement. And it can be as simple as taking that verbiage and adjusting it as necessary for your organization. And then that needs to be signed by an authorized official of that government or tribal organization, and that authorized official is likely going to need to be reported on that application. But that's the statement. Super simple, not complex, and you can use the verbiage from that application.
Great advice. Great advice. Thanks. Okay, next question is from Stacy, and this is when you were talking about your reminders on slide 27. And she says, when we go into PECOS, should we delete the answers in sections 5 and 6 because you said that attachment 1 replaces it?
So no, don't delete them. You shouldn't have to delete them. You'll go in, and if your provider type is SNF, what'll happen is if you were to run the error, the warning check on that application, it would tell you that you're missing questions in 5 and 6. So you should be able to go into the entities that are listed in 5 and 6, and if they need to remain, you'll go through and you'll verify their information, but then you should be able to continue on for the questions. By virtue of that record being set up as a SNF type, those questions have been added to the existing information. Great question.
Great. And this one's similar, but again, I'm just going down the list. Certain hospitals operate multiple SNFs. If one of the hospital's SNFs loses Medicare billing privileges due to non-response, will this impact the overall hospital's billing privileges or just the billing privileges related to that SNF's PTAN?
Yep, just related to that SNF's PTAN, and that absolutely, that's a fantastic question as well, because that does happen. The revalidation is based on the enrollment record for the SNF. It's not going to deactivate any other entities under that tax ID. It is purely that SNF's PTAN. This is a SNF focused revalidation effort.
All right, great. Next question. The 1220 guidance only requires date of birth and social security number for certain listed persons, not all ADPs. I thought I heard you say date of birth was needed for ADPs.
Depends. It's not all ADPs. If you get into a situation where it's an LLC, they're looking for that information. They're looking for those direct owners. So you have to look at the type of individual that you have in that guidance. What we're finding is most of them are being reported.
Great. And then from the same listener, some ADPs refuse to give information on owners. What do we do in that situation?
Excellent question. And CMS does have guidance for that situation. And one moment, I just want to show you where it is. Basically, they're expecting the SNFs to give their best efforts to obtain the data, but if you can't, they don't want you to wait to submit that revalidation. Make sure that you get that, but you do need to make multiple attempts. And then what they're saying here is what they're indicating is that you can provide a statement indicating why you were unable to get that data. Now, that doesn't necessarily mean that that data is not going to be required, but that is going to give information to the MAC that they can communicate to CMS to determine if we can continue without that information. And that information starts on the bottom of page 18 of that guidance for SNF attachment.
Excellent. One last question. How long will it take for WPS to send development request letters after May 1st? Won't they be overwhelmed with all these applications being submitted simultaneously?
Well, and that is why we're encouraging you to send it in before May 1st. You're correct. That is going to be a lot of applications. If you wait until the end, there will be processing delays. If you're submitting them now, though, an electronic application, we do work them in the order and they come as they come. Electronic is going to go more quickly purely because some of the automations that are involved with electronic. Those applications, if we have everything, are typically processed in 15 days. Paper is within 30. Now, the development, they try to be screening, and it varies based on inventory, but typically we're screening a few days after we receive the application. Again, that can vary, so that's not an absolute, but they do get reviewed, and any development needed gets sent out pretty quickly after we get that in. As far as being overwhelmed, we're taking steps to ensure that doesn't happen, but part of that, we do need your help. We need those applications to get submitted in as soon as you're ready to submit them. So if you have everything, send that in. Don't wait until May 1st. We don't want processing delays to happen.
Nope.
I'm sorry, Aline, you cut out there a little bit. Can you say that again?
I'm sorry, no further questions.
Okay. So with that, we are going to do our wrap up. So in a few minutes, you're going to receive a thank you email that's thanking you for attending today. So don't delete this without reading it. This includes a certificate of achievement if you're attending for continuing education credits. So in the lower box on the left-hand side of your slide, you're going to see where it has the completion date and the contact hours. This is an email that can be sent to your certification or accreditation body for that. Now, if you don't get this, one of two things probably happened. This comes from our webinar software, and sometimes that doesn't make it past junk mail and spam filters. So check your junk and your spam folders. And it's coming from WebEx, so consider adding that to your safe sender list for future educational events. The other thing that could have happened is you attended by phone. And if you attend by phone, our system doesn't have a way to confirm your attendance systematically, and so it won't send that certificate of achievement. In either situation, you're not out of luck. Send an email to that WPS Education mailbox, and we'll put that in the chat for you. Include the title of today's session, which is SNF Revalidations, and give me the phone number that you attended from, and just tell me that you didn't get that certificate. What I'll do is I'll verify your attendance manually, and I'll get that certificate sent out to you, so you'll have that. I will be taking follow-up questions for 7 days. Now, questions that are specific to an application in process, those still need to go to customer service because they'll have access to the development letters to see what is still needed. However, if you have questions about the SNF revalidation effort, go ahead and send those to me for the next 7 days. Again, subject line, we're going to want that SNF revalidation there so that the individuals monitoring that mailbox know to get this to me so that I can get a response to you. So now's your chance to let us know what you think. As I said in the beginning, we were going to give you the opportunity to provide feedback, and I would really appreciate it if you take a few minutes to do that. Tell me what you liked about the session. Tell me what you didn't like. Tell me what we could do better. That is how we improve and grow our educational offerings in the future. It's also an opportunity for you to provide feedback on education you'd like to see. Both CMS and WPS use this information. We read through them, we look for them, and we look for ways to improve. So again, appreciate you taking time to provide us with some feedback on the session today. With that, that is the end of our presentation for today. On behalf of myself, Aline, and everyone on the WPS Provider Outreach and Education team, I would like to thank you for taking time to attend today. I recognize that we're all super busy and sometimes carving out this time can be a challenge, so I hope you found this useful. But that does end, excuse me, feel free to send in those questions for the next 7 days, but that does end our session for today. Have a great day. You may now disconnect.